of those best scientific brains in the world, Professor Neil Ferguson from the Imperial College, who sits on the Scientific Advisory Group for Emergencies, says that the predicted death toll of 20,000 now could be radically lower. Is he right?
Well, we're learning every day about how this disease works, and the modelling is constantly improving. I think what he's referring to there, and what the Chief Medical Officer has alluded to, is if people follow the advice and follow the instruction, as it is now from the Prime Minister, stay home, protect the NHS to save lives, we will save lives, and that people doing what they've been told to and staying at home can radically reduce the risk of deaths and the risk of infection, because it cuts that transmission. So the key advice there is, yes, we can significantly bring the potential number of deaths down, but people do need to follow that instruction from the Prime Minister and the Chief Medical Officer and stay home to save lives.
But why would you have suggested a figure of 20,000 then? Was that a scare tactic? Because if you go to China, where, as I'm sure you're aware, it emanated, the number of fatalities, and one is too many, is 3,281. Why did we ever have a figure of 20,000, Minister?
Firstly, you're absolutely right to say one is one too many, and as the Prime Minister said, sadly there will be people who pass away as a result of this. We had modelling which has constantly evolved. This is a new disease. We didn't know how it would behave. We've been looking at the Italian example and what's happening in Italy. We've been looking at China, and the modelling has continued to evolve. But it's not just that modelling. We're also looking at infection rates now in this country. Now we've got more people who have been infected. We've got sadly a number of deaths in this country. But we've also looked at what we are doing to increase the capacity of our NHS to deal with those who do need hospital treatment. All of those factors taken together see that modelling continue to evolve. I think, as you alluded to, in a positive direction in bringing that number down, but it does require us all to play our part in it.
There's concern over the provision of kit, Minister, as you may be aware. You won't have been able to listen this morning because you were doing the broadcast round, I understand that, but we're hearing from a paramedic who doesn't have the right kit and indeed has glasses he has to assemble before he can get to a patient. We're hearing from a doctor who has delivered gloves that are actually out of date. The kit is still not getting through, Minister.
Well, there's a number of points there, Nick. Firstly, you are absolutely right to highlight the importance of kit and supporting our frontline staff. And we often talk about frontline NHS staff. They are vital, but we mustn't neglect social care workers, hospice workers, pharmacists, a whole range of others. And we owe it to them to give them the kit they need to do the amazing job they're doing. We have in recent days seen millions and millions of items of kit delivered across the healthcare system in this country. I think, and I may get my figures slightly wrong, but about 24 million pairs of gloves, about 13, 15 million
some
face
of which are out of
protectors,
date, of course.
as examples. No kit that is being delivered to the front line is deemed unfit for purpose. Any kit that is delivered, I'm assured, by the clinicians and by our scientific advisors, when we are delivering kit, it will do the job. But there's a quantity thing here, a quantity point, which you're absolutely right to raise, Nick. We're ramping up the amount of kit that's being delivered. We've done a drop right across the acute sector, across other NHS trusts. But of course, in the nature of this kit, the teams are getting through it at a huge rate, so it constantly needs to be replenished. We have significant stockpiles in this country. It's now a huge logistical exercise to get it out. The Army have been brought in to help with that. Yes. They do this stuff brilliantly, and they are getting the kit out. But for any trust that doesn't have what they need or has an urgent need, there is set up by my boss, the Health Secretary, an internal NHS hotline number which they can ring and get an instant response and get that kit sent out to them. And so we are really ramping up the deliveries.
Please don't give out that number. But as I speak to what's it called? Indeed. But what is it called? So that next time I speak with a paramedic, I can say, well, ring the kit hotline. So does it have a name?
There's a PPE hotline. NHS trusts have the details of that. Okay. And if their trust needs kit, they should ring through, and we will do everything we can to give them the kit they need.
A couple of things, just quickly, if we can, Minister.
Yeah,
you mentioned this testing. I read it will be made available through Amazon and through Boots the Chemist. Will it be free? What will the cost be? Do we have any awareness of that yet?
Well, I don't want to be premature in talking about individual retailers or route or how that will work. We're still working on getting that testing right,
so we don't know
on a
what it will
scientific
cost will be,
basis to
yeah.
know it works. Further details will follow when the scientists tell us it's good to go, but I don't want to preempt that. But we are doing everything we can to ensure that testing is done at pace, and that when it is done, we can get the kits out.